through a divorce to teach them how to communicate better together. In actuality, I think my job is very important to work with individuals and the couples in order to make the most important relationship of their life healthy, which makes them healthy. On my Inner Voice show, I actually interview some of the prominent psychologists and entertainers in English, and I also speak to some of the psychotherapists who are Iranians and the artists who are Iranians, and I speak in Persian to the Persian population around the world, from Iran or Europe or Japan, Australia, all over the United States and Canada, because obviously I was born in Iran.
Where's Dr. Zeine? Dr. Zeine?
Hello.
You also have been trained in my specific methodology and techniques, correct?
Yes.
Are you willing to talk to her after this show?
Absolutely.
And tell her the step-by-step that she needs to do to deal with what I believe is an addictive personality?
Yes, absolutely.
The family goes through a lot. For boys who are becoming girls, the fathers of the family suffer. They will keep being confused. They look at all the childhood pictures that they've took of their son, and now they look at somebody who's standing in front of them as supposed to be their daughter. Coming up, I'm going to be talking to a psychotherapist about awareness integration model. You really want to know what that is, huh? Coming up. Stay tuned. Hi, I'm Dr. Foojan Zeine Psychotherapist, and I'm here with Nasreen Bafordari, licensed marriage and family therapist. We're going to talk about awareness integration model, a psychological model that I have originated, and Nasreen Bafordari is one of the first therapists who has actually learned and has been utilizing it with her clients. Thank you for coming.
Thank you for inviting me. This is an honor.
Some of the major topics that I actually talk to my clients who are couples are first talking about sexuality. Many people don't know how to talk about sex. Concept of communication about it is something that I actually have to teach the couples in how to do. We talk about sexuality. Many people come into their sexuality in a very automatic way. We can go through the whole experience and wham, have a great time, but being with another human being, it actually takes skills. So becoming aware of every area of how we think, how we behave, how we feel, how we communicate with another human being in order to have an amazing sexuality is part of what we also teach in this AI model.
So much of our sexuality.
People don't talk about finances a lot. They don't have a system. They come from two backgrounds of how they actually have created their finances, and I have to help them create a system and have a great communication in how to follow the system. Another main topic is when they actually have children. Now remember, two people, two backgrounds, two cultures, two sets of values are coming in, and now they actually have to bring those together, and that's where they need how to communicate, be flexible, and really negotiate on one way of handling their kids. Duet, sometimes you guys are entering each other's space and singing together, and then solo. How does that experience for you?
The funny thing is,
in-laws, we have to deal with them. They're always there. They're going to be there. We didn't marry them, but they came with a package. So somehow we have to really, really work with it. And if I have to actually add one more topic that I've had to deal with a lot of couples and individuals is addiction. Whether it's an addiction to alcohol or drugs, pornography, cell phone, computers is one aspect that really, really affects the person's life and in their relationship. With people who are going through recovery from addiction, they've had some sort of a trauma in their childhood. And when we've worked with the awareness integration model with them, clearing the trauma, the choice and the chance for them to relapsing is really minimized. I have been in the field of psychology for about 25 years. I started with seminars in ontology and psychology almost the same time. And I know you were part of the pilot study that we did, and in the result of that pilot study was that people were actually minimizing the depression 76%. They were minimizing anxiety 64%, and their self-esteem was rising about 43%. Now those are astonishing numbers.
You know, I wanted to go through it. I wanted to experience what my client would experience. So I asked you to work on me as a model for the group that was being trained.
Hey everyone, thanks for watching. If you like what you see, you can see more on my website and my YouTube channel. And if you want to contact me, I'm on Facebook and Twitter. Bye-bye. Hello, I'm Dr. Foojan Zeine, and welcome to the Inner Voice Show, a show that's about you and all that matters in your life for you from a psychological perspective. I am so excited that I get the chance to talk to the masters in the field of psychotherapy and bring them to you, because they don't really talk to a lot of the public, and they talk to us as therapists, and I get the chance and the privilege to get to talk to them and have them be my guest and have them and share them with you. Today, I'm excited to have Dr. Debbie Joffe Ellis with me. Let me tell you a little bit about her before I get you to meet her. Dr. Debbie Joffe Ellis was born and raised in Melbourne, Australia. She's a licensed psychologist in Australia and a licensed mental health counselor in New York. The picture you see, it's with her and her husband, her late husband, Dr. Albert Ellis. She's also an adjunct professor at Columbia University. For years, she worked with her husband, the brilliant and the renowned pioneer of modern cognitive therapies, Dr. Albert Ellis, giving public presentations and professional trainings in this approach of rational emotive behavior therapy. In 1993, Dr. Joffe Ellis was, along with Mother Teresa and the physician to the Dalai Lama, awarded a gold medal by the Indian Board of Alternative Medicine in affiliation with the World Health Organization for her contributions to the field of alternative medicine. She has been recognized for her volunteer work with recovery workers and family members of victims of the September 11 terrorist attacks in New York City in 2001 and beyond. And for her contributions to the international development of educational programs on addiction treatment in Mexico in 2008. She currently has a private practice in New York City and also delivers lectures, workshops, and seminars throughout the USA and across the globe. She has written numerous articles and books, including Rational Emotive Behavioral Therapy. She co-authored the acclaimed autobiography of her husband, Albert Ellis, titled All Out, an autobiography, a research-based book on dreaming, which she co-edited with Dr. Stanley Krippner, titled Perchance to Dream, and a demonstration and discussion DVD produced by the American Psychological Association on systems of psychotherapy. I am so excited, and welcome, Dr. Joffe Ellis.
Oh, it's a pleasure to be with you, Dr. Zeine.
I want to tell you a little bit. I want to tell my audience actually a little bit about the first time that I actually met you. It was, I think, about 2003, where I called your office in New York, and I said that I'm writing a book about online therapy, and I would love for Dr. Ellis to be able to see it and maybe write something about it. And I remember that you took us in and you invited us to your home, and you allowed us to meet with Dr. Ellis, and he actually accepted to do a foreword on our book, Online Therapy, which was the biggest honor that I could ever have. And I remember when I met him, I was so impressed. I'm like, my God, he was, I think, 93 years old at that time. And almost like, wow, I wish my brain was this sharp. when I'm at that age, because the sharpness, the brilliance was so apparent, and your love and dedication to him, to the field, and to the therapy modality and all of us was just amazing. So I really want to thank you, and I'm so privileged to have this chance to have you with me.
It's my pleasure. It's my pleasure. Yeah, I remember very well the time that you visited us, and you were so respectful and delightful and delighted. And Al, I call Dr. Albert Ellis Al, funny that was my husband, so I didn't call him Dr. Ellis. But Al very much appreciated your book and the importance. Now, we're talking 12 years ago, and so you're quite a pioneer in publishing a book at that time on that topic. And he was an amazing man and a generous man, and never hesitated to encourage and contribute to people who were also contributing to many others. You know, before you, many years before you, the late Dr. William Glasser, who's the creator of reality therapy or choice therapy, he was corresponding with Al. They had a very respectful relationship.
And I remember Bill or Dr. Glasser telling me that he once sent Al a manuscript, just wanting Al's kind of opinion about it. And within days, Dr. Glasser received in the mail the manuscript with all these handwritten notes by Al with suggestions of how he could add this and try this to improve it or clarify it. And Bill said, you know, he was
so grateful. And, you know, I've heard from so many other people, from the greatest to the everyday person, not in the field of psychology, how grateful they were. And Arnie Lazarus of multimodal therapy had his own thing, and Al encouraged him to open his own institute, which he did. And then there's men and women who'll come to me to this day at conferences and say, you know, your husband or your husband's work saved my life. So his generous spirit not only uplifted so many people, and also inspired within them gratitude, yes, which is a very healthy attitude if one wants to live a very sweet life, no matter how difficult some circumstances can be.
Absolutely.
I'm on a roll here. So
no, absolutely. What I remember also is that we witnessed him actually conducting psychotherapy. And it was funny because there was a crowd that was sitting there waiting to be seen by him, and he did it in a public way. And he promised that he would do the REBT, Rational Emotive Behavioral Therapy, in 15 minutes and get results. And at the beginning, I'm like, oh, sure, 15 minutes. I'm going to time him, actually, 15 minutes. Oh, my God, he did. In 15 minutes, he was done, and the person had a kind of a transformational concept. And not only they had the insight, but they had a behavioral concept, they had a homework, they had all of it. But more than anything, something that really caught for me, which I've never thought of that before, and I just saw Dr. Ellis do it, was that a person was sitting there and saying, you know, I'm having this intense anger and intense sadness about my mother, and they were going and talking about some of their ideas, and Dr. Ellis just said, you know, what is the intensity? And she would say like 10, and she says, bring it down to 2. And I said, oh, that easy? Like, bring it down to 2, and that's an instruction? And she said, well, how? I said, just bring it down. How did you get it up to 10? Bring it down to 2. And she closed her eyes, and, you know, as he was talking to her, she brought it down to 2. That was miraculous to me. And I, you know, later on this past 10 years, I've created a new model, awareness integration model. And one of the inspiration that I've had was through this concept that I learned from him, which is how you are a master of your emotion. And although many of us don't think we are, but just watching him work showed me how much we are master of our emotion and the intensity that we give it. And I know that you are not only wrote the book, and then you also are lecturing about REBT. So tell us a little bit about how the principles of it and how it works in basic aspects of life and everyday life.
Yeah, certainly I will. Gosh, where do I begin? I also, when I present, do those 15-minute demonstrations. Sometimes, if we don't have time for 15 minutes, in 10 or 5 minutes, there can be a transformation. And the brilliance lies not only in Albert Ellis and the fact that he encouraged and created the tool and the format and the framework, but the tool itself, so that you and me and other practitioners can easily use it, and not only practitioners, but the everyday person who's willing to apply it. It's not enough to just read about and think, oh, this is great. One has to apply it. One has to do it. And that's another aspect of the approach, the fact that lasting change requires ongoing effort, ongoing work and practice. It's wonderful to have epiphanies, an Oprah moment, yes, but to maintain the of it, we need to do ongoing work and practice, effort and practice. One of the main principles to answer your question about sharing REBT principles with you and the viewers, hi viewers. You've already mentioned, Dr. Zeine, that we have a choice, that we are the masters of our own emotional destinies. But I better add to that, if we know that we are, if we're willing to think about our thinking, because REBT asserts it's not the events, it's not the circumstance, it's not adversities and challenges in life that create our emotional responses. It's what we tell ourselves about what happens that creates the emotions that we experience. And so if we're willing to think in rational, healthy ways, which REBT teaches us the principles of, then in all probability, most people, most of the time, will create healthy and appropriate emotions in response, even to a very deep adversity. And if we think in irrational ways, and again, REBT defines very clearly what irrational thinking consists of, if we think in those ways, then we create debilitating emotions. And so with awareness, if we're willing to think about our thinking, to be aware, then we have choice. And if we choose to habitually think in healthy ways and to be willing to catch ourselves when we don't, not to put ourselves down, but then change the thinking, then we'll create healthy emotions. Why is that so important? Well, spoiler alert, in all probability, we're all going to die one day. And what a shame it is to not experience maximum joy in this life that will contain suffering and loss. That seems to be an inevitable part of life and living, and REBT certainly isn't the only thing to remind us that. Buddhism, I mean, most of the main religions that I know of and philosophies certainly would agree with that. So given that life in all probability will contain loss and suffering and is finite, doesn't it?
Yes, one of the things to look at the principles of REBT, if you can please explain them and then say how, since you work with them in 10 minutes to 15 minutes, but if I, as an audience who is watching this show, was going to take those principles and use them on a daily basis, how would I be able to do that? So can we go through them and see how each one of them can be utilized as an example?
Certainly. Okay, so the main aspect I've already shared with you. It's not what happens, but what we tell ourselves about what happens that creates our emotions. Secondly, when we think in healthy ways, we create healthy emotions in response to adversity. Let's stick to when rotten things happen. Because, you know, when good things happen, usually we feel happy emotions and we better not change those. When we think in unhealthy ways, we create debilitating and unhealthy emotions. So what's the difference? Okay, when something very bad happens and we have a realistic and rational attitude, then we'll experience sadness, healthy grief, disappointment, concern. If we think in unhealthy, irrational ways in response to a rotten thing happening, not getting what we want or getting what we don't want, then in all likelihood we create rage or depression or anxiety, and these paralyze us and often can lead us to behave in ways that are debilitating or that hurt us and may be harmful to others too. So really important to realize that we have responsibility for how we think and how we feel. Okay, so what are the aspects of rational versus irrational thinking? I'll start with irrational. When we think in irrational ways, we're demanding. It's the shoulds and the musts. My husband came up with the expression, don't should on yourself. So he came up with another word, has a U in it. So the word you're about to hear, it's not my accent and a different word. He came up with the word masturbation, yes. Meaning it must be this way. You must treat me well. I must be perfect. So, and irrational thinking includes those demands, those shoulds, those musts, those oughts.
So kind of like the expectations we have from ourselves or the world, where they're really irrational expectations and they're never going to come through, but somehow we hold them as if we're entitled to those expectations.
Right, and they lead to disappointment at the very least, or worse. There are three core irrational beliefs that most humans seem to believe without questioning it. I mean, it's almost through osmosis, because they're ideas that society, family, schools can put into our heads when we're very young. And these three core irrational beliefs are, I must do well and be approved of or loved by everyone. The second one is, you must treat me well and act the way I think you should.
And what's wrong with those expectations? I think everybody has those, right? Only if we could control the world that would do that, everything would be fine.
Yeah, well, if you find the way to control the world, you better share it with us, hey, Doctor? The third one is, in fact, about the world or life, that life should be fair and just. Lots of luck, right? So they're the core irrational beliefs. Then a few more aspects, if I may, about irrational thinking very quickly. It overgeneralizes, and it doesn't say you did a bad thing, but that you're a bad person. On the opposite of that, rather than saying what a good thing you did, what a good person you are. And REBT reminds us of the danger of that. In believing that we are what we do, is that if we do well and then do poorly, then we put ourselves down and we suffer often from depression and debilitate ourselves in that way. So REBT says that another aspect of irrational thinking is overgeneralization, taking life too seriously, blowing things out of all perspective. And one very final for now, I mean, I can't go into them all in our short time, but the final one I'll share now is damnation of oneself and of others and of life. And very quickly, in contrast to that, rational thinking, which will create healthy emotions when rotten stuff can happen, it doesn't have demands. It has preferences. It's important in life to have goals and wants and desires. But if I want something and don't get it, I'll be healthily sad and disappointed, but I won't be depressed, which I probably could be if I say it should have happened or this shouldn't have happened. So it has preferences when we think in rational ways. We don't overgeneralize. We see life realistically. And one of the core principles of REBT, which as far as I can tell, is not emphasized as much by any of the other cognitive approaches, which wouldn't disagree with it, but they don't emphasize it like REBT does. And that's the importance of unconditional acceptance, unconditional self-acceptance, unconditional other acceptance, and unconditional life acceptance, that we remember that each one of us are fallible and capable of making mistakes, but we still have worth no matter what, simply because we're human and alive.
So when I hear you, what I gain from what you say is, first of all, if I am reality-based, where I check my expectations with reality and see if it matches or not, and if when it doesn't match reality as is, for example, if all human beings are not having that, or it's not something that can be achieved, and it's something that it's an expectation that it might happen randomly, but it cannot be expected of all people at all time, or nor myself at all time, then I will check with reality whether that thought or belief system matches it or not. And if it's not, then bring it into a realistic place. And then when I look at reality as is, then go ahead and accept it. Accept myself, accept the other person, accept life as is. And with that, then also my emotions become more realistic and matching the appropriateness of the situation, and therefore also my behaviors would also match the appropriateness of the situation, rather than, you know, my emotion and behavior being exaggerated in some way or generalized in some way, or that I behave in a way that it's not going to uphold reality, and it creates conflict internally and with the external world, right? Is that what I'm hearing?
Yeah, basically, you know, when we think in irrational ways and create those unhealthy emotions, we can behave in ways that certainly don't enhance our lives and can hurt us and hurt other people. Indeed, yeah.
And it's one of the theories that covers all aspects of it. It covers the thinking part, it covers the emotional part, and it covers the behavioral part, and it covers also the contextual part, which is the acceptance underneath it all. So you got reality and acceptance underneath it, and then you have the three components of thinking, feeling, and behavior when it's being worked through and being awaringly looking at it and you know, doing something about it, which creates a balance in a sense with reality.
Yeah. In my view, Rational Emotive Behavioral Therapy is the most holistic of the approaches that I know of in psychotherapy, because it does constantly remind us of the inseparable interplay of thinking and feeling and behaving or acting. So I love that about it, and I love the compassion that infuses it. The reminder that we can accept ourselves or work at doing it more, and accept others or work at doing it more, even when we or they act in ways that may not be that great. You know, I've had people say to me, and a lot of people used to say this to Al too when he was alive, how can you expect someone who's been raped or someone whose loved one has been murdered to unconditionally accept the person who did those crimes? And a few people have even said to me, you know, Debbie, you're doing a great job of continuing Al's work and carry on, but if you drop, you know, the pushing of unconditional other acceptance, more people will kind of probably accept, don't you think? And no, I don't, because here's the thing. REBT doesn't say we should, obviously, or that any person necessarily will be able to be perfectly unconditionally accepting of all things, people, and self all of the time. But what a worthy attitude to strive for. And it is possible if we're willing to work at it. And what can motivate us to work at it? Remembering that our life is finite, and that if we live in bitterness and hatred and a lack of, if not forgiveness, at least understanding of the wrongdoings of others, then we embitter ourselves and have a miserable life. And if we're willing to remind ourselves that if, let's say someone does a horrendous thing, I can tell myself how rotten, how awful, what can I do to get him, blah, blah, blah. Or I can tell myself, and believe me, I've had a number of opportunities to do this in my life, and I know it's possible, and others have too, and certainly my husband did. Oh, he practiced what he preached, and I strive to do that too. So in any case, if someone does something rotten, and I'm willing to remind myself, if I had their brain chemistry, if I had the belief system they had, maybe experiences that they had gone through in their past, if I was thinking what they were thinking in the moment they did what they did, then maybe I would have done it too. Now, does that put them off the hook? No. Do I think that there had better not be consequences and just sit back and accept? No way. But it helps me have a stable inner climate so that I can make better choices in response if I'm going to respond, or at the very least allow tranquility within my own being so that my life isn't further affected by the wrongdoing that others have done. I hope that makes sense.
Yes, I'm hearing that you're saying that the struggle that actually happens is inside of me. If somebody does something to me and they've moved on, they might have their own struggle, but the struggle that I carry inside of myself, the rage, the anger, the unfairness, whatever emotion, whatever thoughts, and then the emotion that I create inside of myself, I'm the one who's being miserable. I'm the one who's facing it. I'm the one who's feeling it. And in that context, when it's almost like I'm putting myself into misery consistently. And in order to be free from that misery, the value of the unconditional love is a value and a context that I can strive for, and I can, every time I fall off, to kind of get back on it and deal with it and accept it and bring it on, and with that create compassion and understanding of whatever that person was going through in order to do what they did. And in this term, although it's not a one-time deal, it's more of I fall into the misery, I pull myself out with this rope of, the unconditional love and acceptance, and then I fall again, and then I pull myself up, and then finally I pull myself up and off of the misery, rather than just kind of staying there in that ground and generalizing it to other people and generalizing it to life itself. At one point, I would hate everybody and the whole life would become miserable if I generalize it from that context, where I can generalize it from another context, since I can, from a place of the human beings are, generally good and innately good. And if something that they've done that it's horrible or wrong or it's hurtful, is probably because they've also been hurting themselves. And if I can have compassion for whatever hurt that they've had, then I can release myself of that anger and rage, and then be again responsible for, like you said, the climate of inside, be responsible for the state of being that I'm carrying all along and every day.
Yeah, REBT doesn't use the term unconditional love. That might be a bit much for some people to really want to strive for when some person perhaps has acted really badly towards them. But unconditional acceptance seems more realistic. Some saintly people can and have felt that degree of unconditional love for evildoers, but it's rare and not as easy to attain as unconditional acceptance. And I'm happy at some point, if we'll have time, to give you an example of...
Please do. Please.
Yes, okay.
Yes.
And again, if there's time, because earlier you asked me to talk about the principles of REBT. Gosh, we need 3 hours, Dr. Zeine. Share with you the ABC approach if there's time. But while we're on this theme of unconditional other acceptance, so I live very near the Hudson River. I'm pointing there because there is west, and that's where the Hudson River is. I'm in New York City. And one of my self-therapies is going for a walk by the river, and I do that most days, weather permitting. So one day a few months ago, I was going for a walk, and there's a pedestrian path that at some point merges into a pedestrian and cycling path. And as I entered this shared path, I saw a speeding cyclist coming towards me, and I just felt unsafe, and so I went to the very side of the pedestrian path and stopped. Well, it didn't help. He came right into me. I went flying back. The last thing I remember before I lost consciousness was, I don't have time to save myself, which, if he wasn't coming so fast, and he was very heavy, so I would have leaned forward, falling forward. Anyway, so I lost consciousness, suffered concussion. When I woke up, he was there, and he did wait, and he said, "Are you all right?" And I kind of sat up, and yes, I could move, and I was bleeding a lot and in pain, but nothing was broken. And the first emotion that I remember feeling, Dr. Zeine, was gratitude. Gratitude that nothing
I'm alive.
was happening.
Yes.
Yeah. And he said, "Are you all right?" And I said, "You've got to be more careful. You could have killed me. You could have killed you." But I wasn't enraged. I was feeling grateful. And he was saying, "Oh, what can I do to help you?" And the first thing that came to mind, I love animals, I said, "Donate $50 to ASPCA." And he said, I will. And then I got up, because I'm in the middle of on the side of the path, so I went to go to the very edge to get out of people's way. And again, I'm moving, I'm okay, and I felt overcome with gratitude within myself, not rage. And he said to me, "I'm so sorry, it was all my fault, I get into a zone." And I could see that even though I was in more pain, he was more upset. And I said to him, I felt sorry for him, and I said, "Well, we all can make mistakes, just be careful next time." Anyway, I won't go on and on. He went on his way, but before he did, with tears, he said, "Thank you. I've learned so much from you."
Aww.
Okay, so to finish this long story, I went to the hospital. I had symptoms post-concussion and all of that, but even the doctors agree it was a miracle that it wasn't worse. Now, why am I mentioning this? If I hadn't for years applied REBT and the practice of unconditional other acceptance, I don't think I so instantly would not have judged, but focused on, wow, I'm okay. I think it's because of my ongoing practice that what in the earlier years was a conscious effort became an automatic attitude. And so it's an example of how over time it can happen quite easily. Also, for those of us, and I know you're one of them, and I'm sure most of your listeners, if not all, have a tendency to want to contribute in a positive way to others. Out of this situation, the guy apparently learned something, that it is possible to experience compassion for someone. Now, two more things before I finish, because I'm sorry if I'm talking too much.
Go ahead.
If he had not stopped, could I have still felt that way? I thought about it. Yes. But realistically, it would have taken my making more effort, reminding myself, I'm still alive, it could be worse. Life has no guarantees, at least I'm still mobile and all of that. And what if he had abused me and lied and said it was my fault? Could I have felt that steadiness again? Yes. Why? Because in my life I don't want to feel rage or bitterness.
Exactly.
And I remind myself that we're all fallible, and because of my years of practicing it, it's become easier and easier.
I think what you just said was really a great key. I don't want to experience rage and fear and anger. I just don't want to. And it seems like when my intention and commitment becomes that I'm not willing to experience this and continue experience it, then I will definitely take on skills in order to be able to release myself of those emotions as they come up. They might be very valid as they come up, but the point is, do I want to carry it or not? And the minute that my intentionality becomes in my commitment that I don't want to be angry anymore or experience fear, that's when I utilize the skills in a way and practice them so that I become very efficient and masterful at it. So tell me a little bit about the A, because we got the ABC of REBT. We're talking all initials, so.
Yeah, that's okay. So this is an elegant, simple framework that Al created that one doesn't have to be a professional in the field or a client of therapy. Anyone who makes that choice that you just talked about, makes the decision to not want to feel debilitating emotions, can use this. So A stands for adversity. We do the ABC when we realize we're experiencing an unhealthy emotion. That can be our trigger. So one could be feeling anxiety or jealousy or guilt or shame. So the first thing one does is identify the A. What happened? What seemed to cause emotion? I say seemed because remember, it's not what happens that creates the emotion, it's our beliefs about it. Okay, so man drove into me with a bike, drove or rode, or, this woman abused me. Whatever it is, you write down the A, which stands for either adversity or activating event. And then you go to C, which stands for consequences. And it's best done through writing in the early stages. And when you do a lot of it through writing, you can do it automatically in the head more easily. So C, now the most important thing to clarify is the emotional consequence. So what is the emotion that I want to change? So it might be rage or anxiety or depression, whatever it is, you write that. Now, there can also be behavioral consequences. Let's say a person has stopped smoking, and then as a result, they think of what happened, they start again, and it's a habit they wanted to break. So you can write down also the behavioral consequence, but key is identify clearly the emotional consequence. And then we go to B, which stands for beliefs, and we do the detective work. We identify and write down all the irrational beliefs that created that unhealthy emotion. So he shouldn't have, and she should, and I mustn't, and it's terrible that. I forgot to mention one other aspect of irrational thinking is catastrophizing and awfulizing. So write down all the irrational beliefs. Then the fourth step, the D, because it's ABC, but really it's ABCDE. D stands for disputing. And then we dispute the irrational beliefs. Now, another thing that I adore about REBT that isn't done so much in the other cognitive approaches, which also say change your unhealthy thinking, of course they do, but REBT emphasizes precision in disputing the irrational beliefs. So it's not just change, but zap the unhealthy one and then replace it with a healthy belief. So you dispute by asking questions like, where is it getting me to think this? Is it helping or hurting me? Where is it written that he shouldn't or she should or I must? Where is it written? So there's pragmatic and Socratic and logical disputing. And then the next step, the E, after tearing apart, ripping apart the unhealthy belief, is coming up with E, the effective new belief or new philosophy. I can stand what I don't like. I just don't like it. He's a fallible human who does wrong things. It doesn't mean he's all bad. Those sorts of beliefs that don't stimulate and create the unhealthy emotions. And finally, after we've done that, it's really important to do homework, ongoing work and effort for the reasons I mentioned before, if we want to maintain that instead of the 10, the 2. So we could remind ourselves those healthy beliefs every day.
Yes.
Or, if the issue was debilitating shyness, and I can't stand it if people think I'm terrible, and then, you dispute that. The homework could be talking to a stranger in Starbucks once a week. Now, for many people who aren't shy, what's the big deal? For a person with social anxiety, that is a big deal. So pushing oneself to do uncomfortably what one wants to get comfortable at. Really important to do homework.
So you're also looking at, with the way that I have created some beliefs, I have also maybe lacked some skills. And the homework really goes about creating the skills, which either I've had an obstacle moving forward, or I wasn't aware that I needed to do this, and it was shocked or caught into the belief system. And when I know what I don't want and I know what I do want when I go through disputing it, then being clear in what I want, then I put in the behavioral skills in order to go and practice and become better at it, right?
It's really important to take action and develop skills or do other activities that will enhance and encourage the healthy attitudes and healthy behavior.
And I know that you emphasize on REBT being important in this era, in the era of much stress, in the era of much tension around the world. Why is that? Why do you think REBT is important more than any time now in this era?
Well, there seems to be an increase in terrorism, terroristic activities. I mean, throughout human history, I'm sure there's been one form or other of war or conflict or uncomfortable situation, but it seems to be more condensed and accelerated. Now the sort of unknowingness of a group like ISIS, what might they do, where and when, which coffee shop, and then the situation with the plane. So the thing is that there seems to be a lot more uncontrollable, random activity and behavior around us. Plus, in this age of technology, there seems to be less community. More people are in some ways more solitary and doing the social media thing and don't have friends, as many friends or neighbours who they go to physically and are supportive and all. And so we can easily get into our own way of thinking that can be over anxious and paranoid and so forth. And the gift we can give ourselves to be willing to work on having a healthy attitude to the unexpected bad things that can happen in life, and to be willing to also accept ourselves if we find that we haven't acted in ways that ended up being for our benefit and that of others. So with more pressure in the world, how important to do what it takes to keep steady and tranquil within. REBT is a brilliant cognitive approach. I also encourage people to do activities like meditation and reflection and contemplation, to be healthy, happy, holistically.
So in the time of such a pressure that might get us into some sort of attention all the time, some sort of a fear all the time, and that we are isolated behind technology and mobiles and all of that, where it's much easier to not do reality check and just kind of get caught in our own reality and be focus on the version of reality that we choose and keep going at it. It becomes more important to do that type of a reality check with the world and our own head and dispute some of the irrational beliefs that comes up. And we can really gauge that, as you said, with the emotions that are unwanted or uncomfortable or intense and that we don't like it. And attempting to do something about those emotions and knowing that we can. And it's not that somebody else does something to us and we are just the recipient of it, and then we have to get stuck with all of the emotions and the consequences that gets created, but also that the way we think and feel creates those consequences and how I can change it. But also what I heard from you is that in this time of tension and pressure and violence in many ways, and the unknownness that keeps coming wherever you are and not feeling safe in many of aspects, the concept of the unconditional acceptance really supports calming down and feeling safe within one's own skin and where we are and the community, and then maybe that feeling of safety will create our yearning to create those communities again. And the first concept that you were talking about, which was gratitude, if we be committed to these two concepts, which is the unconditional acceptance and gratitude, then more time during the day and the week, we can actually pretty much get ourselves to be in a calm and tranquil and open state of being, which then it extends itself to creating that community and safety all around.
Well said. Yeah, Dr. Zeine, it's so true. And again, it's our choice. It's our choice. You know, at the very end of, when I say the very end, final few years of my husband's life, some really bad things happened in our work environment.
Yes.
And I don't have time, nor do I want to go into them now. But certain people acted in certain ways that Al and I found shocking and very difficult. And the master, Albert Ellis, was tested, and he passed the test because, and at the time, you know, there were newspaper articles and magazine articles, and he was quoted and often said, and it was totally genuine, I know. He said, I hate what was done. I hate what they did, but I don't hate them. And I know he actually had compassion for some of the people who acted in ways he didn't like. One day I was really teary, and he said to me, Debbie, you know, you're such a good REBT teacher and practitioner, but now you're not applying it. He said, accept. They have to do what they did when they think the way they think. Accept. He had compassion, and, you know, in a similar way, when he passed away, you know, here in New York, I was very, very alone, and just fast forwarding a few years, my precious mother passed away in Australia. I was with her when she passed away, and when that happened, and soon after, there really weren't people around me who were supportive, and if I had let myself, I could easily have fallen or created a deep depression. But I didn't want to. So did I feel grief and sadness? You bet. However, I also looked for and focused on what still was good. Here in New York, after Al died, I love animals, I love birds. I don't have a balcony, but I have a windowsill, and pigeons would come, and that would bring me pleasure. Simple things like that. You know, at the end of Al's life, when it was clear he was dying, and he knew it, and all this stuff happened, and it wasn't looking good. He and I, every day, focused on what still was good, because work, you know, money, all of that, very difficult, very troubling, but we still had each other, and every day we focused on the love between us. So again, bad things can happen, and in all probability will happen to each of us one way or another.
Yes.
And during those, not to repress the healthy grief and sadness, to feel them, but also make a choice to look for actively what still is good in this life, and there still is good in this life.
Yes, and I remember actually, I saw the two of you in the Ericksonian Masters Conference. I saw you and Dr. Ellis at the last years, and exactly when all of those conflicts were happening, and you were so accurate. The love between the two of you and the love that he had and you have for the field and the work, and nothing was stopping the two of you. You were unstoppable regardless of what was happening, and because the value system was there. So I really have high regards for you, and very high regard for Dr. Albert Ellis. Thank you so much for being in my show. It's always great to see you. I get the privilege of sometimes seeing you at the conferences, and I hope that you will accept my invitation to join me on my TV show again. And thank you that between all the conferences around the world that you have to go, that you gave me the time and my audience the time to be with us.
Oh, it's my great pleasure. And Thank you for the very fine work you do in educating and inspiring people. So my pleasure. Thank you for asking me, and yeah, invite me again. I'll be here.
Wonderful. And thank you, all of you, for being with us. Until next week and another show of Inner Voice. Create a wonderful day and year and life.